think a lot of it depends on the patient that you have in front of you in terms of their symptoms and whether you have a pre-test probability of that patient having small intestinal bacterial overgrowth. In certain clinical scenarios, particularly in patients with connective tissue disorders such as scleroderma, with typical symptoms, and they may be bloating, abdominal distension, some change in frequency or form of the bowel habit, then breath testing can be useful to confirm that diagnosis of bacterial overgrowth. Again, there's quite a lot of controversy in the field about outside that sort of context in patients who have just bloating and distension, and how much bacterial overgrowth may or indeed may not impact on their symptomatology. Treating those patients, again, is largely unknown in terms of what's the most efficacious and effective way of managing these patients. But my own practice is, if we get a positive breath test, I would generally treat that with antibiotics, or indeed an elemental diet can be very helpful. But my view is that it's often very helpful to repeat that breath test after an appropriate period of time to see whether the test has resolved and the symptoms have got better, but also patients with bacterial overgrowth can redevelop that bacterial overgrowth even when you've treated it successfully.